I think we'll just start over there on the end with Bóas. Your 2 minutes of reflection on the discussion.
Thank you very much for your lecture and all the other lecturers here today. It's been a very enlightening discussion and very informative, these things that have been pointed out. As a member of the Icelandic Psychological Association and have been practicing psychologist for 10 years, both within the mental health, within the child and adolescent sector, working with children and families, these concerns you raise and points, they are in line with a lot of my personal experience, and very interesting to hear that spoken so clearly. The Icelandic Psychological Association for the past few years has urged the government to ensure that people with mental health problems are granted access to evidence-based treatments, and emphasized the advances in psychological treatment that have been backed up by robust evaluations over the past decades. So we have empathized and tried to get the current and past governments to grant people more general access to psychological treatments, along with other necessary evidence-based treatments that can help people. This being in line with what we see as a response to the tendency, the trend that we see in our society, that we are inclined to use more drug treatment than other forms of treatments, and people's access to mental health services has been easier to get access to drugs than other treatments that we know are evidence-based and proven worthy of testing alongside the medical ones.
Thank you. 2 minutes up.
Okay.
So, hello, and thank you very much, Dr. Allen, for your interesting lecture, and the other speakers as well. It's been an interesting afternoon.
Herði, þú ert að tala betur í hljóðnum en bara?
Heyrist betur núna?
Yeah.
Okay. And also, in the Psychiatric Association, we a few years ago we studied your book a little and had a discussion about it. So these are ideas that are very important, issues that are very important to raise, and talk about. Some of the issues that you face in America are not as pressing here. They're a little bit different, but there has been a tendency, and I totally agree with you and most of us too, that there is this problem that we are definitely using resources too much for the worried well, and not focusing enough on those who are really ill, and that's a very, very important issue to raise. And the other very important issue is that we help each other, and we have this discussion. All the professionals who are working on mental health and the patient organizations, that we have a discussion on the forum, and we work together to help people with mental illness, which is extremely important. And as you said, Dr. Allen, in the end, there has to be balance and common sense in everything. There are no absolutes. We have to have an open discussion. These are complicated issues and difficult problems, and we need all of us together to make life better for people with mental illnesses and their families.
Thank you very much. Perfect. 2 minutes.
Well, again, thank you very much for this day. And I want maybe not to go in this discussion, but if we have to work together, I want to put the focus about we will listen to people who are speaking about their experiences. And I think the big problem all this year, the professional we have put us on this level, and have the power over the other people because we knew so much. And I think it's a problem with everywhere in the health problem, mental health and health. And I am demanding you people who are calling this year professional to listen to Einar, to listen to Öðna, or to listen all the people who are in the saal here to listen to us, because it's the people who have experiences, it's the people who know about themselves, and I think if professional and association like Geðhjálpar are going to speak together, we have to have with us much more people who are experiences and who can help each other. It's the thing I want to say.
Thank you very much. Guðbjargar?
Yes, thank you. Yes, thank you very much for your lecture, Dr. Allen, and the others for their very important stories. I've been working in this field for too long, probably, but almost 40 years. And I always go over the time, just to tell you. But there was a colleague of mine, a Norwegian one, who was a pioneer in the psychiatric nursing. She was asked when she was at a party or in the television when she was 90, what has changed in the mental or in the psychiatric nursing the most? And she said, the size of the medicine cupboard. Mm-hmm. And I must almost totally agree, because when I started many months ago, there was this little cupboard in the ward for the medication. Then we moved to a finer new facility, and then there was this little room. And now when I visit the wards, the room are huge, and there are cupboards all over the place, and I wouldn't be able to work there for 5 minutes, but that's another story. Of course, we have been listening to very important issues that we have been addressing for a long time, both in my profession and others. And I think this is exactly the right time, and the timing is right now. And I think, because I've been working in the community for over 20 years, and there we should be we should emphasize on like you said, Dr. Allen, that this is, if we are going to prevent the same experience as in the States, we have to get funding and get money to enhance the services in the community. And there I would go to that. I would stress that factor, and of course we don't need to close all of establishments, but the community, the housing, the jobs, the work with psychotherapy and on other levels. And of course to talk together and work together, because otherwise we are just little fragments all over the place.
Thank you very much. Which you actually mentioned some of the fields of the social workers. So, your reflection?
I'm a social worker in hiding.
Social worker in disguise. Well, I want to start by thanking you all for your lectures today. It's been very enlightening, and I would like to point out or emphasize on the prevention. And since I've been working with infants and unborn babies, I would like to point out that probably the best prevention in the mental health system is starting early. I realize that it's not cost. I mean, it's a long-term work. But if we do it properly, and like economists have pointed out, one especially, a Nobel Prize winner, James Hackman, has pointed out the cost if you prevent, or if you prevent properly, the cost is 8 times lower in the school system, in the health system, in the social system, and I think we have to try to make that voice louder. That is to say, the long-term prevention factors. We have to be able to see them and point them out. Also, I want to emphasize that we turn our system a bit around, because the way we do it in Iceland, we try to cure the disease, rehabilitate people, and then we start focusing on the housing problems. But we should actually start on the other end, because you can't go into rehabilitation without a proper place to stay. So that would be my.
Your 2 minutes. Thank you.
Thank you.
Hrannars?
More raising of hands. How many here are politicians? No, the single one. Okay, so we have a problem. Okay. So I think part of the problem is also a political one. And I think much of what we are talking about today, and we've been talking about for years, and I was surprising to hear Alan to be speaking, the words I've been wanting to say, and I've been saying to some people, and many people know about the problems, but I think we are working in our separate areas and doing our things, and we don't get to the ears of the people that are in power, that are allocating the resources. And we have this title, have we gone off course? See, if we are not thinking about where we are going, there are powerful interests there that will decide on the course for us. So I will ask you, please speak out. It goes for, all of you. It's not enough just to be a psychiatrist, working with your patient, or a psychologist, or a social worker, or a occupational therapist. There is a huge social aspects, or how we organize a society. That is also a part of it, and we cannot just leave it out. There are a few. Also, I'm left with a few questions. I really would like to know, say, how here in Iceland, how large is the group, like in women over 40? How many of them are taking SSRIs, And I genuinely want to know, and also with the old people and benzodiazepams, and I just know, I know so many examples of people that, we are not doing the correct thing there. These are just a few reflections. Thank you.
Thank you very much. Dr. Allen, I'm going to wait to give you the word till the next round, because there are two striking facts that remain with me after this that I would like to get your response on. One was what Hrannars said in the beginning. He said, I would trust each and every one of you with my life, but I do not trust the system. Now, there's a fundamental flaw when someone that has had to use the services, if that is his experience and that is those are his feelings. I trust you as a person, but the system, and you could hear that obviously from the actors of Hlutverkasetur as well. And number two, the striking fact that 74% of mental medication is prescribed by GPs. So I would like to, before I'll give the word to you, and then there's also more for you to maybe respond to get your reaction and a few words or comments on those two incredible facts and what can be done to change this. Should we just take the same round? Bóas, if you would start.
Great questions, both easy and difficult to answer. But my 2 cents are, understandably, with an underfunded system, it's difficult to trust its efficiency. And many conferences and meetings similar of this have been held through for the past years, pinpointing and reports written about the current status of the mental health system in Iceland and lack of coherence and how the different systems work together. This, especially in my experience, which is primarily based in the child and adolescent sector, very challenging because we have numerous instances of children with ADHD or autism disorders that have to wait up to 2, maybe more longer for a final diagnosis. Then the treatments or interventions available are not available as best as could be. So sometimes we have set up a system that raises false hopes, that puts people and children and families waiting for a long time to gain access to services that in retrospect are not there. We do not have, and we hear this people complaining about this, both parents and school teachers and mental health professionals, that this is an underfunded system. We can't afford, in my opinion, treatment is always costly, but not giving people treatment or intervention is too expensive. That's my opinion.
Thank you. That's a good point. Trusting the system, but no, trusting the people, but not the system. That's something we hear a lot, often in the media about the whole hospital, especially medical system. People often recounting the stories about how they went into our university hospital and staff was wonderful, but the system was not functioning correctly. I think we do have a funding issue, like he was mentioning, and the access when people have mild psychiatric problems that could be solved with psychotherapy or counseling or shorter interventions. People are often not getting that in primary care. So that's one point. But that is supposed to get better. According to the new policy, we are having some increased funds in psychological treatment in the primary care. So that's at least a step in the right direction.
Okay. First, about the problem of to trust the system or not. They were speaking about have more money to do better thing with the system. I work for 35 years with most of the people who are sitting here, and I can assure you it's very good people. I like them very much. And I don't know, it's only the problem of the system. I think it's a little bit of black, white, the people and the system. I think we have to regard also, and in the system, it's not always good people. And I am not criticizing somebody personally now, but we know in every workplace it's people who don't assume their work. And I am speaking about training now. It could be also something to look if everybody who is working in the system is at the right place. But definitively, because I worked for such a long time, the last year have been terrific because it's not enough money, it's not enough people to work, and when the people are not enough, they are running with the work, so it's not a good thing. And like I say, I work in the system for many years, but I don't know if I will trust this system for my children, so it's not a good answer. And one more, it's very good people, most of them, but I know also people who are not on the right place. About the problem of the GP are the first people who speak, and they are maybe not the right person, also because they have too many patients, have to give the pills to just take the next patient. It has been, we have been talking here in Iceland for many years to put more money in the first service in the health, who is Heilsugæslu. And I think it's very good now we have to have more psychologists to work there, but I think we were mentioning, and sometimes people are problem because they are out of money, other people have missed their job. So I think it will be very important to have a team with much more people and only psychologists and doctor. It could be okay maybe to have also social worker, occupational therapist, nurses, and work with this time idea of the team is trying to find what is the problem. Okay.
Thank you. Guðbjörg.
Yes, about the system and the trust. A lot has been said about it. That is also my opinion. I mean, it is a complicated thing, I think. There's no right or wrong answer in that or opinion. I mean, the system is made of people, and the system was for a long time very old-fashioned with the structure of the power, very hierarchy.
The hierarchy.
That is not a good thing. The balance for the patient, for the user, because the patient is usually at the bottom, and so there can be all kinds of misuse in this power layers, and that has happened everywhere, I think. And now I think as the system gets more multi-professional, it is. I think that is a better way of getting things right for the patient, for the user, and I think with the ideology like empowerment, recovery, and all these factors that are now been tried to implement into the system, I think that is a good thing, and that can help the system. But the system is, like I said, only the people, and the power, and it's been run by this hierarchy, and so I don't have any.
You don't
specific, I don't have the solution right now, but it soon will be. Just wait and see.
In 5 years. Yeah.
I think we all have we have to visit Trieste all together and learn from them. And also about this medication, that has also been explained. There are quite few other professionals in the healthcare system and in the primary healthcare. Mm-hmm. And that also has to be more team. There has been more teamwork there, and other professionals as doctors or psychologists. But I don't know. This is the antidepressants, but the antipsychotics or the stimulants. I don't know if that is the same number in that area. So I would like to know that. Mm-hmm.
Well, there isn't very much to add to what has already been said, but it's a bit contradictory, though, that trusting the people but not the system, since the system is only the people. But maybe, I don't know. I mean, we've got funding problems, of course. Also, maybe it's a process of patience to get better. So maybe it's not a good experience to be sick in an institution, and even though everyone is nice to you, it's not a very good place to be. So it might be a combination of many things. I would also like to point out that about the problems in the primary health care system, I think it's easily solved. I mean, if you have more people helping you to diagnose and treat, you're more likely to be successful. So having more professionals and more staff in the primary health care would solve a lot of problems, I think.
But then it's for Hrannars to answer the question that you actually raised yourself.
Yeah,
and
I'd
then
like to
yes.
also maybe to correct also, there are some people, I don't know all of the people, maybe they are, but there are definitely some people that I would trust, but not all. And then this is just, by you start to know people, and you start to, take a liking to people, and that what they're saying makes sense, and which is good. And also I think it's good that there is diversity. There are different things, and I don't think it's a one-size-fits-all thing. I don't think it's a technical solution that, like Alan said, that, it's a very complex. The brain is a very complex thing, and it has, so many. And so we need to, for what works for one person doesn't necessarily work for another, and so for some people it might mean that they have to have the space and have the time to explore to what is fitting for them. And I don't have the answer either, but I think it's if there is a problem of trust, we must of course talk about it and work, to solve it. Another thing is this thing of prescribing. Well, there are. I'd just like to state, the world works in a certain way. Okay, there are many people whose job it is in the world to increase the amount of prescribed medication. This is why marketing of pharmaceuticals is about this, and I think it's not a conspiracy. That's just the way how the world works. So the way here in Iceland, it's through the general practitioners. So that's one thing. So one thing is also the education of general practitioners, and also the education in the medical education. From the early 80s, there was this mantra, or the gospel was that we have it almost. It's only a question of about 5 years when we have the correct medication to really solve it. So now we have, we just have to take this medication, but in a few years we'll have it. But it hasn't quite worked out this way for many people, and it has also introduced many problems. And but there is a whole generation of professional people that were educated, believing this to be true. And we all, of course, we have to educate ourselves, and we have to discuss these things. This is what I have to.
Thank you very much. Now, Dr. Francis, I'd like you maybe to have the last 5 minutes and give us a little wrap-up, maybe.
First off, I don't think there will be great breakthroughs. There are not wonderful new drugs in the pipeline. The pharmaceutical industry has pulled out of psychiatry after making a fortune because of the realization that there's no longer any low-hanging fruit. So the purpose has to be to make better use of what we have and to apportion things with an allocation that makes sense. And this isn't rocket science. It's not difficult to do. It just needs to be done. Medical systems in general tend to be terribly run almost everywhere. Mental health systems even worse. If you ran a business the way that we run our medical systems, it would fail. No other system is quite as inefficient and as misallocated as medical and mental health systems. Making them private makes it worse because the profit motive drives everything in just the worst direction. So what can be done? I think it's a very large fight because, interestingly, this is a tremendously well-organized meeting. The dinner last night, very well organized. The one group missing is the only group that counts, the politicians. It's interesting that there's a tendency to forget where the power is, and we don't talk to each other enough, but we certainly have to join together in talking to one another so that we can present a unified view, and to realize that if you don't convince the politicians, the rest of the talk may be mostly wasted. The pockets usually are different, so the budgets don't make sense. Each person is thinking about his ministry, his budget. It doesn't come together because there isn't one system. There are many subsystems that are working at cross purposes. And then there are terrible vested interests, so anything you do will hurt someone. And the question is, can you balance the hurts in a way so that they can be tolerated by the institutions and really be helpful to the patients? There's lots to be optimistic about here, though, that you have tremendous advantages over what we have. First of all, you have a meeting like this with reasonable people who aren't fighting with each other, who have common sense. You could find common ground easily in the people in this room. That's a tremendous advantage. You have small size with accessibility. It's very hard to move 325 million people. It's difficult, but not nearly as hard to move 325,000 people. The politicians here are accessible to you. I had dinner with your president once. You get to meet people. You see them on the street. If you had a unified attitude, vision, and plan, you could probably get people to listen. And if you're persistent enough and determined enough and unified enough, I would guess you could get change. Your vested interest in nothing as powerful as ours. So we have a $3 trillion, imagine that, $3 trillion a year medical industrial complex. The big pharmaceuticals own the politicians. The hospital systems are very powerful political. They have huge budgets to fight against. In the United States, any change is a David versus a Goliath. Here, I think the odds are much more even. It's more of an egalitarian society, an accessible society. I think you could do a lot better than we ever could. I think you have neighbors and models in the other Nordic countries. So that I can't compare in detail. I've been to all the Nordic countries. I've spoken to each of them. And I understand something about each. But I can't in detail compare the way you work. But I think that the most rational countries in terms of government, in terms of welfare programs, social systems, are the Nordic countries. And it would be useful to find out if there are representatives that you could be meeting with on a regular basis so that you're not just meeting with each other to unify, but you're meeting with the mental health professionals in the other Nordic countries as well. I think that systems are different than people. You can have very well-meaning people and very lousy systems, and then they don't work. And that even if each system has very nice people, if they're not somehow aligned in proper incentives, the whole thing can be an absolute catastrophe. It's a David and Goliath issue to change anything, but if I were ever to bet on a David, it would be this David. Your Goliath is a lot smaller, and you're bigger than the Davids in other places, and much more unified. In many places, the patients, foreign patients, and the physicians, and the social workers, and the psychologists are all fighting with each other like crazy. There'd never be this degree of unification, I think, anywhere that I've been. So that's a tremendous plus. You're a unified David. I think that you have an opportunity here that's unusual to have dramatic, systematic changes. If only you can get your own plan together and present it in a way, and if you don't get a hearing the first time, the second, they'll be tired of you after a while, and changes may occur. And I wish you luck with that.
Thank you.